This week on Healthy Living, how to remove obstacles for disabled workers, we take a look. Belgian-Rwandese singer Adele Monheim shares her story of struggle and hope as a person with disabilities. And the World Health Organization sounds the alarm on the impact of lead poisoning. We'll have these stories and more in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Linor Moudou. Get this, at least 80% of people with disabilities of working age are unemployed in developing countries. In most developed countries, persons with disabilities are twice as likely to be unemployed than those who have no disability, according to the United Nations. UN data shows that there are more than 80 million disabled people in Africa, including those who suffer from mental health issues, birth deformities, and other physical impairments. Observers say, among other things, stigma, the lack of formal education or vocational skills, and lack of access to assistive devices such as wheelchairs prevent many people with disabilities from entering the workforce. The UN cautions that various factors such as aging populations, starvation, conflicts, and disease will contribute to a rise in the number of disabled people in the near future. The National Disability Employment Awareness Month is celebrated in the United States each year in October to recognize the role and contribution of people with disabilities in the workforce. VOA reporter Arzuma Compaore met some of them and has their story.
My name is Ricardo Bill. My age is 28. I was diagnosed with disability. Some things I couldn't do, like reading and math, stay awake in school. I just didn't like it going to school.
When Ricardo graduated from River Terrace High School in Washington, D.C. in 2016, his teachers reached out to his mother. They wanted Ricardo to enroll in programs of the Developmental Disabilities Administration, or DDA, and Rehabilitation Services Administration, or RSA.
Miss Boatman was one of his teachers, and she did all the paperwork for him to get a case manager down DDA. So
DDA helps residents with disabilities receive the services and support they need to lead self-determined and valued life in the community. RSA focuses on employment. They both fall under the umbrella of the Washington, D.C. Department on Disability Services.
We have people assigned to all of these schools to identify students with disabilities who may benefit from our services, to provide what we call pre-employment transition services, which are a number of different services to help students prepare for post-secondary success, to help them prepare for either post-secondary education, training, or employment after high school.
DDS helped Ricardo find his way to Galaxy Healthcare Solutions, which helps students with resume writing, interviewing, and job hunting. The help he received changed his life. He now works 2 jobs and could not be happier.
The thing I'm really proud of is making my own money. I don't have to ask for nobody else for nothing else no more. Before I started working, I didn't have anything else to do. I had to stay in the house.
It's a program that works for everyone. Ricardo, his mother, and his employers at Mom's Organic Market.
Ricardo does a little bit of everything. You know, he helps customers. He'll do a lot of bagging groceries for customers. He does a lot of cleaning. He's definitely our cleaning guy here because he's so good at it and so thorough and a hard worker.
when I see Ricardo working, it's a good feeling for me because I pushed and pushed and pushed for so hard for him to be able to get employment. That's good for him and for me.
With my 2 jobs, I feel successful, and I want the whole world to see I'm doing great. I am happy. My goal is to get my own restaurant. I want this whole thing go viral.
A program that is giving people with disabilities the ability to dream.
Liman Usman is president of the Disabled Person Social Needs Initiative. He tells us more about what is happening in Nigeria.
Major issues, especially with disabilities in Nigeria, will be the facility itself, accessibility to the facility. You find people with wheelchairs not finding it easy to wheel themselves around the health centers. The blind people as well may find it difficult to move around if they don't have a sighted guide around with them. And then attitude also contribute. What I think can be done to bring about change, instead of emphasizing that there should be a certain percentage of persons with disabilities given employment, why don't you empower them to be job owners, to be business owners? So if you empower persons with disabilities to own businesses of their own, then you have made it possible for them to have people get attracted to them, and interactions will always get better from there. And the way to do this is to initiate policies that will make it easier for them to own such businesses. Financial institutions should have means by which the persons with disabilities can access finances easier than others. And then government institutions can also make it possible for them to have lands in a much easier way than other people can have, so that if they want to establish such businesses, it will be easier for them. As long as we remain at the poverty line, where we don't have the ability to command respect amongst society, then you cannot get health services to our advantage or education. People don't really understand what is to be called disability. Something that is not difficult for one to understand. For instance, a deaf person, you may say, he cannot hear, and that is an issue. But the only reason you think that way now is because I speak in the language that you understand. If I am speaking in English and a Frenchman is next to me who doesn't understand English, he needs an interpreter. Wherever you go to, you need people to respect you and put you in the status of a human being that should be treated like human.
Adele Monheim was born in Rwanda and adopted when she was a toddler. The young woman was born without legs and received prosthetic legs after moving to Belgium. Now an adult, she navigates her daily life between work and other activities. A talented singer, she says her prosthetic legs have enabled her to live a more active life. She shares her story.
When I came to Belgium, a few months later, I was operated because on the small parts of my legs, I had toes. So they had to remove them so I could wear prosthetic legs. And I received my first mini legs. So I was 2, and I needed to learn how to walk and how to hold my balance. Going to school, that was very hard for me because either I had to go with my bike or take the bus, and it was a challenge. Also bullying. Some people, they see something, but they don't really know what it is. And then I say proudly, yeah, I was born without legs and I walk with prosthetics. I drive a car, I work, I did Girl Scout, swimming. I had a lot of hobbies. People are scared. They don't know what to expect. They hear, oh, she has no legs. It's going to be horrible. But when you see me without the legs, I'm just shorter. It's like I'm sitting on my knees. So yeah, there's a lot of judgments. In my friends' circle, the women, they say, oh, just go swimming with us, or just take your legs out and just relax and chill. And with men, it's like, yeah, they're reserved and a little bit scared. I can do more things with my prosthetics when I'm working and doing my social life than without them. When I get home, the first thing I do is take them off to really relax. The most difficult thing is like, especially in the summer, because with the prosthetics, I always have to wear long pants. So it's very hot in the summer to wear them. Because you see girls and they have skirts and they wear heels or sandals, and it seems like they're free. But other than that, I can do all the same things that other people do. Everything people without legs do or with prosthetics is 10 times harder. The input you have to do, your body, your muscles, your balance. For example, I worked in retail also, and we had to walk a lot to put away the clothes. And they always said to me, you work 2 times as hard as we do, and you don't complain. The misconception I would like to correct is that people think that people with a disability are lazy, that they don't want to work. It's not true. We work, we live, and we have the right to be seen and to make part of society.
Former CIA disguise expert Robert Barron has been making prosthetics for people affected by injury or disease for almost 3 decades. Karina Bafranzian talked to Barron about his work.
For almost 3 decades, Robert Barron has been creating silicone prostheses for people who have lost limbs or parts of their face because of illness or injury. His patients have included cancer survivors and even a little girl whose ear had been bitten off by a raccoon.
And how do I put the pores in here? With a toothpick. Now that drives you nuts.
His career started in the 1960s when he was working as an illustrator for a U.S. Navy magazine. He then joined the CIA, where he used his artistic skills to make replicas of documents. From there, he became a disguise expert working with wigs and masks and specialized prosthetics.
If you can change somebody's identity, then you can give that identity back to disfigured people.
One of his patients is Wayne Gearhart. Gearhart is a cancer survivor.
I had a tumor up in my sinus cavity, and if they didn't get it out, it was heading north. So they had to remove my whole nose and make sure they got the whole tumor out.
Barron's main task is to create a custom and realistic prosthesis. Barron says he learned his craft from masters like Hollywood makeup artist John Chambers, who worked on the 1968 film Planet of the Apes and did occasional work for the CIA.
Realism is the ideal technique to make something look like it's supposed to look.
Barron recalls that at one point Chambers invited him to work in Hollywood, but he said no. He says his main source of happiness and inspiration is real patients.
The World Health Organization is sounding the alarm on the impact of lead poisoning. WHO says an estimated 1 million people die from lead poisoning each year, and millions more are exposed to low levels of lead, causing lifelong health problems, including anemia, hypertension, immunotoxicity, and toxicity to the reproductive organs. Many victims are children. UNICEF estimates that 1 in 3 children in the world have unsafe levels of lead in their blood above 5 micrograms per deciliter. Lead is toxic to the body, including the central nervous system and brain, the reproductive system, kidneys, the cardiovascular system, the blood system, and the immune system. WHO recommends that the source of lead exposure should be identified and action taken to reduce and terminate exposure for all individuals with a blood lead level of more than 5 micrograms per deciliter. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linoch Moudou. Until next time, stay well and strive to make every day a healthy day.